Hello friends, if you've been having hair fall or a hair loss problem, these are the 7 absolutely unmissable facts that you should know about a hair transplant procedure. My name is Dr. Amit, I'm a plastic surgeon, and these are the 7 very important things that you must know about your hair fall or a hair loss problem. First, hair transplant and hair fall prevention are 2 separate things. Hair transplant can take care of a hair loss wherein you have lost absolute amount of hair, whereas a hair fall treatment is meant to reduce further hair fall. So if you're having any thinning and you are a potential for losing more hair in future, then you need to get onto a hair fall control program, which may be in the form of testosterone blockers or minoxidil or multivitamins or PRP. So you must check with your doctor about that. Second, a hair transplant is a permanent phenomena. So if you do a hair transplant in the proper way with a proper doctor, your result is guaranteed for life. Because the hair is taken from a permanent zone on the back of the head, this hair will never fall off, and a hair transplant result is almost always permanent, and only very special situations will exist where you might lose some hair, so you need to talk to your doctor about that. Third, who should be doing a hair transplant procedure? So this is a very controversial aspect. It is a fact that plastic surgeons are the best trained doctors to do a hair transplant. Why? 1, they are surgeons. 2, they are taught about aesthetics. They know how to manage the operation theatre. And then the surgeons know about every form of surgery. They know about complication management. They know about the medicines. They know about the surgical procedures, the surgical instruments. So any other specialty like a dermatologist or an MBBS doctor or a homeopath or an Ayurveda specialist does not know these aspects. So it is important that you always select a plastic surgeon for your hair transplant procedure. Fourth, there is no difference in any technique. Now, whether you do FUT or whether you do FUE, the results are absolutely the same. So don't be taken away by the fact that someone might tell you that FUE is better or FUT is better. The results of every kind of a hair transplant technique is the same. Fifth, FUT leaves more scar compared to FUE. That is a myth. We have proven on many occasions via pictures on Instagram as well as videos on YouTube that FUE actually causes more damage and more thinning in a donor area compared to FUT, and a well done FUT does not even leave a scar. It leaves the finest of lines which you cannot see. So the problem with FUE is severe thinning can be caused by a large FUE program, whereas in FUT you do not notice any change in your donor area at all. So my recommendation to all our patients is to always do FUT in order to get the best results. Sixth, older age groups or very younger age groups cannot undergo hair transplant. Again, a myth. If you are suffering from a reasonable hair fall and a hair loss problem, then it is important that you can take treatment from a plastic surgeon and do a hair transplant procedure even as young as 19 to 20 years of age, or even people up to 70 or 75 have had hair transplant and have had a completely normal result. Last, hair transplant is the only way to get a completely natural result. A properly planned and a properly executed hair transplant procedure gives you the most natural look. It is done under local anesthesia. You can get back to office as soon as the next day. And in fact, there is a technique called long hair transplant where you can actually go to office after 3 days. We do not cut a single hair from either the donor area or the recipient area, and no one will ever know that you ever had a hair transplant. So there's a lot of very interesting things about hair transplant. Always talk to a plastic surgeon to know more about it.